Remember, June is Lipedema Awareness Month. Let's get out there and tell more folks about lipedema. Whether it's on social media or talking to your family, let's spread lots of good information about lipedema.
Hi, I'm Dr. Michael Girouard. I want to talk to you today about HCG. What'd it be? HCG stands for Human Chorionic Gonadotropin. Now, I started using HCG in my weight loss practice all the way back in 1981, but HCG for weight loss goes all the way back to the 1950s when a doctor, an endocrinologist by the name of Dr. Simeon, used it to treat men with Froelich syndrome to help them lose weight. And starting back in 1981, I saw the benefits from HCG. HCG, when properly used, in the proper dosage, with the proper timing, seems to help tremendously with fat tissue loss. You may not see it on the scale, and that's because fat really isn't that heavy. Fat takes up a lot of space, and what patients have told me for over 40 years, Dr. Girouard, I'm losing a tremendous amount of inches. And that's what we see with HCG. Now, I was the first physician anywhere in the world to use subcutaneous HCG. I was also the first physician to use it in the dosage that I use it, and that's why it seems to work so well. You see, what we've learned with medications is that different dosages of medications can produce completely different effects. You can give a medication in a very high dose and get one effect, and give it in a low dose and get a completely different effect. It's almost as if they were both different medications. We know the right dosage. We know how to adjust dosage in our patients, and that's through experience in treating over 200,000 patients over the last 40 years. We have seen tremendous benefits from HCG, and I'd like to share with you some of the other uses that we see with HCG. HCG has tremendous benefits beyond weight loss.
If you're wondering if you have lipedema, the most common symptoms are the following. Difficulty losing weight, especially on your hips and thighs, despite being really good about what you're doing. Eating right, exercising, and the weight's not coming off those thighs, you might have lipedema. If you have tender spots in your legs, you push on them and they hurt, you may have lipedema. If you have a size discrepancy in your clothes, so let's say your top, you wear a size 10, and your bottoms, you're wearing a size 16, you might have lipedema. If you notice that your legs swell, that they're puffy, that they're bigger than maybe you think they should be or bigger than they used to be, you might have lipedema. If you notice that your legs are puffy during the day and they don't go down at night, you might have lipedema. If you notice in your family that the women tend to be a little bit more hippie and a little bit larger in the thighs than other families, you might have lipedema.
You know, so many people think that weight loss is a number on the scale, and it's not. We recognize that it's people doing certain things, meeting them where they are, getting into their emotions, getting into their thought processes, and dealing with them as individuals. Let me give you an example. People would come in to me and they'd tell me two things that I could never understand. They said, Dr. Girouard, I love French fries. I'm not a French fry person. I'm not a starch person. I'm a sugar person. Give me dessert. Do we have to eat the meal? Just get to dessert. But being able to relate to them and saying, yeah, I know there are people that love starches. Let's talk about starches. Let's talk about alternatives. Then I get the folks that come in and they're me. They love sweets. And they tell me, gosh, dessert is the best part of the meal. And it's like, yeah, I know exactly what you're talking about. I've got several medications that will help you with sweet cravings and that'll just knock it out completely. And a lot of times they look at me like I'm crazy. But it's being able to relate to them and saying, look, it's not a willpower. It's not a won't power. It's your chemistry. It's your biochemistry. And what it's affecting is how you feel. And that's what we try to do. We try to bring that one-on-one contact. You are a unique individual. You're not like the patient who just walked out. You're a unique individual. That's how I'm going to treat you. That's how I'm going to love on you. I'm going to make you feel loved when you leave here. That's what we do different.
Hi, I'm Jennifer, and I've been a patient actively for about a year, and I've been on the program with the doctors, and I've lost about 112 pounds from April until now. They are very understanding, very knowledgeable. They really relate to you because a lot of them have been in the same shoes that I have been in. So they really relate, and they're very patient and give you the right information that you need. I recommend it to anyone who's had trouble with any of their weight loss.
At times we'll have patients that come in and they say, you know what, I don't want to take anything. I don't want any supplements. I don't want medications. I just want to know, what can I do differently to help me lose a little bit of weight? Do I need to lose a little bit of weight? And the best way to answer that question is to do a body composition. I realize you don't necessarily have one of those at home, but you can go to a local gym and check. And if your body fat percentage is above 25% for a man, you need our help. If it's above 30% for a woman, you need our help. Now, those can change with age, our recommendations, but really 25% for a man, 30% for a woman, those are where we need to be or below from an overall health and wellness standpoint. So that is our goal for our patients, is to get their body fat composition below those marks, because we want them to be healthy, not just to lose weight, but to help them get healthy. Remember, June is Lipedema Awareness Month. Let's get out there and tell more folks about lipedema, whether it's on social media or talking to your family. Let's spread lots of good information about lipedema. So I get asked a lot, what stage am I? What stage am I? Is stage important? Yes and no, okay? What I want to encourage people is, no matter what stage you are, when you're diagnosed, you aggressively treat your lipedema. And the whole goal is that we don't progress. So if you're at stage 1, that doesn't necessarily mean, hey, no worries, I don't need to do anything about it. It still means you need to do really good self-care so you don't progress in your stage. Okay, so at stage 1, your skin is still very smooth, soft, supple. You're not getting any real firmness, almost no dimpling. Sometimes you can see slight indentations, but no true dimpling. And does everyone progress from one stage to the next? No. So you could stay at stage 1 all of your life, or stage 2 all of your life. But depending on what those epigenetic factors are, those external forces are on your body, weight gain, stress, trauma, hormonal changes, medications will determine. And if you have a connective tissue disorder like a hypermobility syndrome, that can be then putting you over into advancing stages. Stage 2, so the skin is starting to dimple. Many times people think, oh, there's just a little bit of cellulite. It's scar tissue that's starting to form, and what's happening is the skin is getting retracted down, and that's what we're seeing with the dimpling. We actually call that mattressing. And we get thickening and fibrosis starting to happen. So instead of being soft and supple, it's a little more firm. It doesn't move as easy. And for those of you who do lymphatic massage, you can feel the difference of that tissue, right? So stage 3 is progressing on, more thickening, more hardening. We're starting to get larger nodules, but we do not have lymphedema yet. Does that mean that the lymphatics are not involved? Not at all. The lymphatics are involved, but they're not so overwhelmed that we have lymphedema present. Okay, we know from biopsies and studies looking at the lymphatics in lipedema, and with the biomarkers that are now being shown, is most likely the lymphatics are affected from the very beginning. We just don't see the evidence of that until stage 4. And then this is stage 4, so we're getting folding happening, and then look at the top of the feet. That would be a positive Kaposi stemmer. You'd be trying to pinch skin up on the top of that foot and it wouldn't come up at all. Over here with this stage 4 over here, you can't really appreciate it, but it is present there as well. So stage 4 can look like this, it can look like that. Just depends if lymphedema is present or not. There's so much information about what you should eat out there that our patients are almost always super confused when they walk in the door. So our goal is to give them the basics and help them build upon that, not just with artificial foods, supplements, meal replacements, but really learning how to eat with real food. Because at the end of the day, it's not about a diet, it's not about a 6-week plan or an 8-week plan or even a 6-month plan. It's how can we help our patients eat healthier for the rest of their lives? And that will help them control their weight for the rest of their lives.
I guess one of the most questions we get, Dr. Girouard, just tell me what to eat. I'll give you some ideas. I don't know what you like. You might like liver. I don't hold it against you. We've had ladies come in and say, Dr. Girouard, I don't like meat. Well, is there a protein that you do like? I love chicken. Well, let's talk about chicken recipes. You can fricassee it. You can grill it. You can barbecue. There's a million different recipes, and we have some recipes to offer them. Here, this is how you do chicken. Wow, I didn't know it could be this easy. Yep, surely can. And that's meeting that individual person. That's the whole key. Who are you? What do you like to eat? What are your home challenges? Dr. Girouard, I'm a single mom. I've got 3 kids at home. I can't go out and exercise and I'm limited in my budget. Oh, no problem. We've got solutions for that too. And getting those people past that, treating each person as an individual. They're not like the person that just left my office. They are a whole new person. So every day, if I see 30, 40 patients, I'm seeing 30 or 40 individual people who need individual attention.
Remember, June is Lipedema Awareness Month. Let's get out there and tell more folks about lipedema, whether it's on social media or talking to your family. Let's spread lots of good information about lipedema. Do varicose veins make lipedema worse? My opinion, yes. Are there studies to support that? No. The reason I say yes is any time that we have extra fluid that leaks out of any vessel, veins, lymph, whatever, contributes to the extra fluid that is around in the extracellular matrix or the space around the cells. And we know both in animal and human studies that fluid that hangs around like that, excess lymphatic fluid, stimulates fat cells to grow. So if I have bad leaky veins and I have lots and lots of fluid hanging around, am I going to eventually develop excess fat in that area? Yes, I will. Now it may be lipohypertrophy, meaning just extra fat growth. Or if I have lipedema, it's going to stimulate my lipedema fat to grow more. When we tailor an eating strategy for someone or a nutrition plan, it really depends on what they're looking for. If we're looking for trying to implement intermittent fasting, which is a really hot topic, and I love talking about time-restricted eating, which is actually the correct phrase, and there's some great information published out there, and there's some garbage published out there. So when you filter through all of that, you come back to, again, what is the purpose? If you're looking for decreasing inflammation, if you're looking at decreasing insulin resistance or decreasing insulin-like growth factor, fasting between 12 to 14, even 16 hours on a routine basis can be very, very healthy. But you have to do it right. You have to get the right interval at the right times and then ending your fast in the right way. You can also fast too much, which can then start to decrease your thyroid function. And that's a very common problem in patients that we see that aren't eating enough, is they've prolonged that fasting regimen thinking that they're doing the right thing, but in fact, they're down-regulating their thyroid function and now have maladaptive thyroid function. And we have to overcome that to try to get them healthier. So when you look at eating habits, it's not just food composition, it's timing of it as well that is really important to get right.
Hi, I'm Dr. Michael Girouard. I want to talk to you today about HCG. What it be? HCG stands for Human Chorionic Gonadotropin. Now, I started using HCG in my weight loss practice all the way back in 1981, but HCG for weight loss goes all the way back to the 1950s when a doctor, an endocrinologist by the name of Dr. Simeon, used it to treat men with Froelich syndrome to help them lose weight. And starting back in 1981, I saw the benefits from HCG. HCG, when properly used, in the proper dosage, with the proper timing, seems to help tremendously with fat tissue loss. You may not see it on the scale, and that's because fat really isn't that heavy. Fat takes up a lot of space, and what patients have told me for over 40 years, Dr. Girouard, I'm losing a tremendous amount of inches. And that's what we see with HCG. Now, I was the first physician anywhere in the world to use subcutaneous HCG. I was also the first physician to use it in the dosage that I use it, and that's why it seems to work so well. You see, what we've learned with medications is that different dosages of medications can produce completely different effects. You can give a medication in a very high dose and get one effect, and give it in a low dose and get a completely different effect. It's almost as if they were both different medications. We know the right dosage. We know how to adjust dosage in our patients, and that's through experience in treating over 200,000 patients over the last 40 years. We have seen tremendous benefits from HCG, and I'd like to share with you some of the other uses that we see with HCG. HCG has tremendous benefits beyond weight loss.
So over the years, I've seen HCG not just help me, but help other people as well. Another personal story is when I first went on HCG, I was really struggling with carpal tunnel. Carpal tunnel that had come on after my third pregnancy and just didn't want to go away. I was using night splints, and my hands were still and fingers were still tingling and falling asleep at night. I was pretty miserable. I couldn't drive my car without having to wear splints in my hands to keep my hands from falling asleep. The HCG, within about 2 months of starting it, I wasn't using my splints anymore. Made a huge difference. And as you can see, I've never had surgery for it. So am I a big fan of HCG? Yes, I am, because I have a personal bias because I benefited from it. Does that mean all of my patients do? No, but the vast majority have, and have been very, very thankful that we continue to offer it as part of our program. Is it a requirement? No, we offer it for those that want to try it. The last way and the most recent way that I restarted HCG was for those pesky hot flashes. And you know, I was really resistant. And I sat down and I thought, well, why am I doing this to myself? I'm miserable. I'm waking up with hot flashes through the night, can't get back to sleep. Now I'm irritated that I didn't do anything about it because I know what to do about it. So finally, after about 4 months of not sleeping well, I said, I'm going to go back on the HCG. And you know what? Within my second shot, my hot flashes have been gone. And I am a much happier person. I think everybody's happy that I went back on it. So I just wanted to share my personal experiences with you because, not that everybody reacts the same way and not that HCG is for everybody, but it definitely can help a lot of our patients like it's helped me. You can find HCG on the internet. I'd caution you that that probably is not the safest or the best option to use HCG. It has to be injected. So it's a medication. It needs to be prescribed. If you're getting HCG that's not been prescribed and it's not in an injection form, it's not really HCG, and you won't see the benefit from it.
Hi, I'm Jennifer, and I've been a patient actively for about a year, and I've been on the program with the doctors, and I've lost about 112 pounds from April until now. They are very understanding, very knowledgeable. They really relate to you because a lot of them have been in the same shoes that I have been in, so they really relate, and they're very patient and give you the right information that you need. I recommend it to anyone who's had trouble with any of their weight loss.
When do you reach out and get some help? And that's a great question. You have to be ready to do something different. So when you say, you know what, I'm ready, let's do something about this. I am tired of beating myself up. I am tired of doing the same thing over and over again and not getting any results. There is no shame in asking for help. If it was easy, we would not be here. If what you're doing is not working, you need help. And don't wait till it's 20 pounds or 30 pounds or 50 pounds or 100 pounds. Come in when it's 10. It's so much easier to lose when all you have is 10 pounds. Remember, June is Lipedema Awareness Month. Let's get out there and tell more folks about lipedema. Whether it's on social media or talking to your family, let's spread lots of good information about lipedema. My 3 favorite exercises, and anyone who sees me know that she's talking about rebounding again. So I brought a rebounder. So when you are looking at rebounding, you're not getting on the trampoline like with your kids, okay? It is very, very light. So you're not jumping up and down. All we're trying to do is just gentle movement, okay? I recommend one that has a bar, because if you're like me, I'm like, looking around, I get distracted, and then pretty soon I'm falling off. So what I'm looking for is just rebounding. When you feel comfortable, then doing something with your arms, okay? And you don't have to be up on your toes, you can be flat-footed. All I'm looking for is movement up and down, okay? When you feel comfortable with your arms, then you can start doing things with your arms. What I don't want you to do is to do this, because where's my fluid in my hands? Hanging out in my fingers, right? So I need to be moving my arms. I can put them up here, I can put them up in front of me, I don't care what I do with them, but I need to move them. I will tell you, when you first start rebounding, you'll be like, wow, that's really kind of hard exercise. So I usually say start with 3 minutes. Try to work up to 10 to 12. If you can do 20, more power to you, but I'm looking for 10 to 12 minutes. So rebounding works in a few different ways. The movement up and down helps stimulate your lymphatics. It also gives you resistance training and aerobic training at the same time, so it's an incredibly efficient exercise. The other thing that rebounding does is it helps prevent osteoporosis, and I know all of my patients that lose weight are at risk of osteoporosis. So that's another reason that I promote rebounding. Efficiency, something you can do at home, helps our lymphatics, helps burn calories from both aerobic and resistance training, and helps protect our bones.
So how does tirzepatide work? Tirzepatide reacts with 2 receptors in the gut, the GIP and the GLP-1 receptor, to feed back to the pancreas and tell the beta cells in the pancreas to secrete more insulin. That's the first thing it does. The second thing it does, by telling the pancreas to secrete more insulin, at the same time, it tells the liver to stop making glucose. We call that gluconeogenesis. We don't need all that extra glucose, because when we don't use it, it gets turned into fat. The third thing it does, it decreases blood sugar by increasing the amount of insulin secreted and by decreasing insulin resistance. When your cells are insulin resistant, they need more insulin, so you naturally secrete more and more and more over a prolonged period of time. But with tirzepatide, reversing that insulin resistance, the little bit extra insulin you secrete makes it much more efficient. Also decreases the amount of circulating glucose, so there's just not as much a substrate to make fat tissue. The fourth thing it does is that it delays gastric emptying. Food stays in your stomach longer, so you feel more full for a longer period of time and you eat a lot less food. The fifth thing that it does is it works not only with delayed gastric emptying, but it reacts centrally in the brain to make you feel full quicker. Patients tell us that they eat about 1/3 less food and are totally satisfied. Finally, tirzepatide decreases glucose levels, and that's why it's a good diabetic drug. All of these things combined produce tremendous weight loss, gives good appetite control, and makes it much, much easier to stay on a good, healthy weight loss eating plan.
Remember, June is Lipedema Awareness Month. Let's get out there and tell more folks about lipedema. Whether it's on social media or talking to your family, let's spread lots of good information about lipedema. "85% of women who have lipedema have reported that they have some type of adverse mental health effect, coping abilities as a result of their lipedema. About 18 to 40% have been reported in the literature of having both anxiety and depression that has been directly impacting their care for lipedema, or their lipedema has affected their mental health. And I think that's very understandable. In living with a chronic condition, we see similar, if not higher, rates for diabetes as well. Difference is that with diabetes, many people don't know you have it. With lipedema, it's a very obvious physical disability at times, and so it's not something that you can hide and keep private. The first thing we need to do is to get good support. And why is that so important? Lipedema is a chronic disease, and we know that if we don't support you emotionally, spiritually, that at some point it will start to affect you physically. And so ignoring that psychological aspect is really, really detrimental. So we need to find good support for you. And if hopefully you have people in your family and your close-knit friends that are supportive of you, and if not, please reach out so you can get that support. 85% of women who have lipedema have reported that they have some type of adverse mental health effect, coping abilities as a result of their lipedema. About 18 to 40% have been reported in the literature of having both anxiety and depression that has been directly impacting their care for lipedema, or their lipedema has affected their mental health in that way. And I think that's very understandable. In living with a chronic condition, we see similar, if not higher, rates for diabetes as well. Difference is that with diabetes, many people don't know you have it. With lipedema, it's a very obvious physical disability at times, and so it's not something that you can hide and keep private. And being able to share with each other is really, really important, and then lifting each other up and saying, right, okay, that's where you're at, let's move forward. How do we get to a better place?
My personal weight loss journey begins when I was a young child. I was extremely overweight. In fact, when I was 6 years old and it was time to make my first communion, my mom and dad had to have a communion suit tailor-made for me. I was too big to buy anything at the store. And I'm embarrassed to admit this now, but when I made my first communion at age 6, I got in line twice to get an extra host. I love to eat. I tell my patients all the time, given a choice between sex and food, I could be a fat priest. I was just really emotionally hurt by all the criticism and ridicule I got from classmates, from friends. Finally, in 7th grade, I got tired of it, and I went ahead, I quit drinking sodas, I quit eating candy, I started to jog, and I lost 60 pounds. And I felt so good because people looked at me in a different way, and I felt good about myself. So I carried that all the way through to medical school. I did a residency in anesthesiology, and I enjoyed doing anesthesia. But while I was doing anesthesia, I started working at a weight loss clinic, and I found that I could help people because of my personal experiences. And as an anesthesiologist, I could take away their pain physically, but that emotional pain I only achieved when I helped them lose weight. I had a lady come in my office one time when I had the clinics in New Orleans, and she was getting ready to leave. The visit was over, and before she got up, she said, "Dr. Girouard, I feel so good with this visit." And then she started to cry. And I said, are you feeling bad? I said, is there a problem with the medications or something with the diet? She said, no. She said, you don't understand. The next time somebody will tell me something nice is in 30 days when I see you again. And it really, it hurt my heart so bad. I started to cry with her. And I said, you know what? What we're doing here is not just helping people physically. We help people emotionally. We help people to feel better about themselves. And that's so important because once they start feeling better about themselves, it's like a snowball downhill. It gains momentum. And they say, you know what? I'm going to do the things that I need to do. I'm going to make the compromises that I need to make to feel good, to look good, to fit in my clothes. And I think that's what we do with patients. We treat them physically, but we help people emotionally. But that's what got me started. And making people feel good made me feel good.